For just a moment. Good morning, everyone who is remotely connected. We will be starting the meeting in just a few minutes. Thank you.
I'd like to call the meeting of the Audit and Compliance Committee to order. Will you please call the roll? Madam Secretary, will you please call the roll?
Director Ryder?
Ryder is here.
Director Taylor? Is absent. Chair Harrington?
Present.
You have a quorum.
And we don't have any directors participating remotely.
That is correct.
Okay. Is anyone registered to provide in-person or virtual oral testimony or submitted written testimony to be included in the record?
We did not receive any registrations nor any written testimony.
Then we will proceed. We'll have a report from Chief Corporate Compliance and Privacy Officer, Nicole Admiral. Chief Corporate Compliance and Privacy Officer will review our Audit and Compliance Committee charter.
Good morning, directors.
Good morning.
My name is Nicole O'Meara, Chief Compliance and Privacy Officer. Today we have an overview of our compliance program along with a request to review and approve the Audit and Compliance Committee charter. We have metrics to share both on the system side and the county care side, and also recoveries for county care. And thank you. This slide depicts the 7 elements of a successful compliance program as stated by the U.S. Sentencing Guidelines and the federal OIG. These are the standards that we would be held to if we were audited. We have spent considerable time on each of the 7 elements, with particular attention to the left side, the prevention side. We have compliance and privacy has over 30 written policies and procedures. On the compliance program oversight bucket, I'm happy to report that we have 2 new members of our compliance team. We have a compliance officer on county care, and we also have a new compliance analyst for county care. On education and training, this has been really the focus. We have done extensive training this year on HIPAA refresher, EMTALA. We have done Medicare and telehealth training. So we are hoping that this training will lead to more specific fraud, waste, and abuse and privacy issues to our office. On the internal monitoring and auditing bucket in the middle, that is our hotline, and we have had a 45% increase in hotline reports this year over last year. And when we've looked at it, there is an increase in privacy and fraud, waste, and abuse, which we think is a direct result from all of our training efforts. Next slide, please. And we did not revise the charter, so if you would please, it should be in your packets, request to approve.
Any questions? Hearing none, can I have a motion to approve the proposed Audit and Compliance Committee charter? So moved. I'll second it. Are there any questions on the motion? All in favor? Aye. All opposed? The ayes have it. The motion carries.
Thank you. As far as metrics for the provider side, we're at 703 contacts. That's any contact that the compliance office has had. It's just down slightly, about the same from last year. It was 743. The most exciting piece on this slide shows that we have doubled our privacy contacts and our fraud, waste, and abuse. Both of those metrics have gone way up, and we think that that, again, is a direct result of all the training and education we've put forth. And on the county care side, we have had our contacts are up 30%. Last year they were 431, and now it's 561. We have, again, an increase in privacy and fraud, waste, and abuse regulatory a little bit. We have added a new education and training contact there to show, hopefully, that this will go up with each passing quarter. Again, because of the effort we've put toward education and training. For metrics, for recoveries for county care, so we're on the left-hand side, the recovery metrics, we're at 5 million, which is less than last year, almost 2 million less than last year. But you will see if you look at Q3 and Q4, they're up considerably. And this, we believe, is because of all the efforts we have expended with the COVID lab remediation. And we will be seeing those efforts in the next coming, I'd say, 6 months to continue to rise. That was a large effort, and it expended a lot of our resources. So we hope to see the fruits of that labor continuing in the next coming months. Similarly, on the proactive preventative loss, we are up, which is good. And then you'll see the Q3 and Q4 again are much higher than previous quarters. And again, we believe that's because of the efforts with the COVID lab remediation. We have also gotten preventative loss metrics now from our new PBM, CVS. So we are getting their numbers as well, and so that is also causing the increase. Are there any questions?
No questions here.
Okay, thank you.
That completes your report. Thank you. The next item on the agenda is to approve the minutes of our August 2nd meeting. Are there any questions?
No, I would move that we accept the minutes of the last meeting.
I will second. All those in favor?
Aye.
Aye. Motion carries. The committee will be going into closed session. Action is not anticipated to be taken in open session after the closed meeting has adjourned. Can I have a motion to go into closed meeting pursuant to the following exceptions to the Illinois Open Meetings Act, 5 ILCS 120/2, parentheses C, 1 and 29.
So moved.
I'll second. Are there any questions on the motion? This motion takes a roll call vote. Madam Secretary, can you please call the roll?
Roll call on the motion to go into closed session, aye or nay. Director Ryder?
Aye.
Director Taylor is absent, and Chair Harrington.
Aye.
That's 2 yeas and 1 absent.
The motion carries. We will now go into closed session.
Need 2 minutes.
Thank you, sir.